I was asked to talk about L transposition, seeing as I guess we've had a couple patients recently. And mostly for this one, this is a little bit different than some other talks. I'm going to try to extract from you guys the information that you know and what you don't know, because I don't think you learn as much unless you kind of go through what you know and don't know. So don't be afraid to be wrong. Fellows don't know this stuff either. So first of all, why don't you tell me what is L transposition?
Well, it's malposed great vessels with also malposed ventricles.
Okay,
So properly positioned atrium, and then everything else is swapped.
Okay, so it really refers to the arrangement of the great arteries, the arrangement of the ventricles in space, and what they're connected to. Transposition, no matter what's L or D transposition, always means the same thing. Transposition always means the aorta comes off the right ventricle, and the pulmonary artery comes off the left ventricle. It doesn't matter where they are in space. That's the transposition part. Malposition actually is where you don't have a ventricle. So we use that term, for instance, where you have a single ventricle and where the aorta and pulmonary artery are switched in space. So they're malposed, but because there's only a single ventricle, you don't use the term transposition. Because like I said, you have to have an aorta coming off your right ventricle, PA coming off your left ventricle. The L and the D actually refers to where the aorta is in space. It's the terminology is D for dextro, which means rightward, and L for levo, which means leftward. But that's unimportant for you guys. What it really means is a little bit what Suzanne said, which is really where are those ventricles in space? So L transposition, sometimes called corrected or congenitally corrected transposition, sort of means two wrongs make a right. And so the typical case, what you have.
Did you get it now?
Off? Yes.
You want more potassium?
No.
Does not.
Is that your right atrium and your left atrium are located in their normal places in the body. The right atrium to the right, left atrium to the left. The right atrium is connected to a left ventricle. And the valves always go with the ventricles. So if this is going to be a left ventricle, it's going to be a mitral valve, because the valves are cut out of the myocardium of the ventricle. They have nothing to do with the atrium. Okay? So wherever the left ventricle is, that's where the mitral valve is. Wherever the right ventricle is, that's where the tricuspid valve is. So the right ventricle is on the left side. Left ventricle is on the right side. By the way, this has nothing to do with dextrocardia. That's where the heart is on the right side of the chest. This patient happens to have that. It's got nothing to do with anything. You can have L transposition with levocardia or dextrocardia. Think of it as levocardia because it's easier. This is complicated enough. So, right atrium's on the right, left atrium's on the left, right ventricle. So now this is a tricuspid valve. Okay? And because it's transposed, as I said, the definition of transposition means the aorta comes off the right ventricle, which happens to be on the left side, and the pulmonary artery comes off the left ventricle, pumps blood to the lungs. So if this is all you had, L transposition, how would you know anybody ever has heart disease?
Until that right ventricle starts to get a little tuckered?
Well, so that's one possibility, but the real answer to the question is you never know. There are people out there who have corrected, so-called corrected transposition or L transposition. If they have no other anatomic abnormalities, they'll never come to a doctor's attention. Now, about 75% of kids with L transposition will have associated cardiac anomalies, and those are what bring them to the attention of the doctor. Okay? So it's very rare to have this without anything else, but you can.
I will pause.